Have you ever wondered how communities manage to keep serious infectious diseases like tuberculosis in check? It takes a coordinated effort, and at the heart of that effort are public health guidelines. Public health tuberculosis guidelines are essentially a roadmap, a set of organized recommendations developed by health experts. Their main goal is to prevent, control, and ultimately eliminate tuberculosis within a community. They provide a clear, consistent approach for healthcare providers and public health officials to follow, ensuring everyone receives the best care and that the disease doesn't spread. These guidelines are crucial because tuberculosis is an airborne disease, meaning it can spread simply by breathing the same air as someone with active tuberculosis. Without a standardized approach, tracking cases, ensuring accurate diagnosis, and providing complete treatment would be incredibly difficult. The guidelines help health departments quickly identify individuals who have been exposed, connect patients with treatment, and monitor their progress. This prevents new infections, reduces the risk of drug-resistant strains developing, and protects the most vulnerable among us, like young children and those with weakened immune systems. Organizations like the Centers for Disease Control and Prevention in the United States and the World Health Organization globally create these recommendations based on the latest scientific evidence. So, what do these guidelines mean for you? If you or someone you know has been diagnosed with tuberculosis, these guidelines ensure that your local public health department will initiate a contact investigation. This process identifies people who may have been exposed, offering them testing and preventive treatment if needed. They also standardize diagnostic procedures, like specific blood tests or chest X-rays, ensuring accuracy. Most importantly, for those diagnosed, the guidelines outline treatment regimens, including which medications to take, for how long, and how often. Following these guidelines ensures you complete your treatment, which is vital for a full recovery and preventing the disease from spreading. One particularly effective strategy outlined in these guidelines is called directly observed therapy, or DOT. This is where a healthcare worker or another designated person watches a patient take their medication. It might sound unusual, but it is incredibly effective at ensuring patients complete their full course of treatment, even when it lasts for many months. This strategy helps prevent drug-resistant tuberculosis, which is much harder to treat. The guidelines are also constantly updated with new scientific discoveries and best practices, reflecting a dynamic commitment to public health. Ultimately, public health tuberculosis guidelines are a powerful tool for safeguarding our collective well-being. By providing a clear, evidence-based framework for diagnosis, treatment, and prevention, they empower healthcare professionals and communities to work together. This coordinated effort not only helps individuals overcome tuberculosis, but also builds a healthier, safer environment for everyone, reducing the overall burden of this challenging disease.